Hey everyone, Nathan here, president of Saybrook University. Welcome to another episode of Saybrook Insights. Prior to my role as president here at Saybrook, I had the privilege and honor of working at the Christ College of Nursing and Health Sciences in Cincinnati, Ohio. And prior to becoming its second president, my first role was serving as the dean for general education, which was also or eventually the liberal arts and sciences department. My president, Teresa Goodwin, had the vision of educating nurses and allied health professionals, ensuring they had a strong foundation in the humanities, which to this day, I am still amazed by the sense that, in the sense that undergraduate education, especially in single purpose institutions, is so laser focused on professional outcomes. And the humanities often get short shrift in this regard. Yet, President Goodwin's vision for a humanities-centric nursing and allied health curriculum was ironclad. As a nurse who received her education at a liberal arts college, she felt the importance of these courses would only maximize the future professionals' capacities and would be a long gift to those students across their lifespan. Well, I was absolutely on board with the idea. My nursing colleagues, the faculty members, they were dubious at best. I had to prove it to them, right? Part of my responsibilities entailed teaching several courses, among them 4 sections of humanities through the arts. My background in music, performance, and fine arts certainly made this a reasonable fit, at least until we hired a full-time professor. And in that course, we covered everything from architecture to dance to painting and sculpture to music and more. One day, after about 2 years of teaching the course, I received a call from a patient at the Christ Hospital. The individual identified themselves as an architect, and he had just been in for surgery. During his post-operative care, he and a student nurse from our college began having an in-depth conversation about, of all things, architecture. She began asking numerous questions about different form, function concepts, probing his knowledge about architecture, seemingly to check her own understanding of, get this, what she had learned in our humanities through the arts course. As I listened, somewhat stunned, he concluded that he needed to go. He needed to get back to getting better, but he wanted to personally thank me for our curriculum. He asserted that this one woman's ability as a student nurse to take the arts, and in this case, architecture, and apply it to his own professional background and use it as a part of her healing practice made him feel more than just a patient. He felt acknowledged as a human being. And he also said he was feeling better, in large part, he asserted, because of that conversation. The power of the arts in healing is no accident. Whether it's art, music, dance, or more, we can often see in real time the healing potential of the expressive arts in activating a part of the human mind and body as equal partners in the healing process. Whether it's how one applies these concepts learned in their own profession, like that nursing student, or the therapist who uses actual expressive arts like drawing, painting, etc., there's something to it, right? And I'd be remiss if I failed to mention the amazing gifts that so many artists, whether they're musicians, dramatists, etc., contribute to this healing profession and this work that they do in connecting with patients day in and day out. So it's really powerful. What I'm hoping to do here today is really dig into the idea, the process, the concept, ultimately, of art therapy and arts as a modality for healing. Enter Ms. Christina Grosso, current mind-body medicine student and faculty member in the art therapy program at New York University. Her rich background has provided Saybrook tremendous expertise as we explore adding the expressive arts as part of our palette of degree offerings, pun intended. Suffice to say, I am looking forward to learning more from Christina about art therapy, the concept, its applications, its connection to the mind-body, and how we can use the arts to transform the health and well-being of the communities we serve. We have a broad canvas on which to paint here. All right, enough puns for one day. Let's get to it with Ms. Christina Grosso. All right, everybody, we're here on Saybrook Insights. Christina Grosso, what a joy to have you as our first official student and our first NYU faculty member for the season. I think the NYU part is like in ever, forever. So we're really glad to have you here. Before we get started, tell us about yourself, your personal history as it relates to the arts, art therapy, your journey into mind body medicine, and how you found your way to the vaunted, venerable Saybrook University.
Oh, I'd be happy to. So I've been sort of a integrative person my entire life. I was the kid that was on a dance team and was a math geek and a science geek and an artist and never really knew how all of them fit together. And I guess as a young person through 12th grade, I really had fantastic teachers that allowed me to do all of the parts. And when I was graduating from high school, I had to make a decision. I applied to art schools and pre-med. And ultimately, I decided to go the art path. At the time, my grandmother said to me, "You were born with this talent. There's something you have to do in following it." And those words really, I think, were a big part of my guidance toward art school, and a life in art galleries and painting and trying to get my work out there. And somewhere along the line, I just felt like being in that sort of environment and selling art and being in the business side of art just didn't fit. I really felt the need to help people, and I was really called to that. I come from a family of helpers and law enforcement and public servants, and I really felt called to go back to school. And I, at the time, went to school for art therapy. I went to NYU for my master's in art therapy and psychology, and was again really just trying to figure out how to make these two things come together that I felt were part of me. I spent 20 years in the field working nonprofit mental health and trauma informed practices. And I was still searching. I wanted more education. I wanted to really deepen my studies, but nothing felt right. And I was actually coordinating a panel of students that had come back from NYU who were working in the field, and they were lecturing on the amazing work they're doing. And one of the students was speaking, and in her presentation mentioned a colleague who was getting their doctorate in mind body medicine at Saybrook University. And it was this moment of like, what is that? And I immediately went on my phone. I was looking up the program, and I laughed because I feel like it was Saybrook found me. I looked it up, I saw the program, and a few weeks later I was talking to Dr. Fortune, and a few months later I was enrolled as a first year MBM doctoral student. So it's sort of a funny pathway, but it just sort of landed in my lap in a really beautiful way.
I so love hearing stories like that. And while yours isn't unique in the sense like that Saybrook found you in that regard, your journey into Saybrook and what you've been able to experience along the way and kind of that tickle, right, that you got from that one student and the colleague is just so cool. Planets aligning, that's so interesting. Well, why don't we dive right into it? Because I have all these questions swirling about art therapy. And in my intro for your episode, I referenced how a nursing student taking my humanities through the arts class used her learning in relating to a patient and how, according to him, he was an architect, it transformed his own healing process. And that was just a conversation, right? I mean, about architecture and the arts. Talk about how and why expressive art seems to have that impact on healing based on your. I did not realize you were 20 years in the field, which is incredible. So, like, you've seen a lot in the transformative power, I'm sure, of the arts and healing. So, I'd be curious what your thoughts are on that to kick us off.
What a great question. I think first and foremost, it comes from my own personal experience. Art has always been excuse me, a vehicle for my own expression. And I found that I was most drawn to create at times of turmoil in my own life, crises. It was the way I organized and understood what was happening, kind of by the pieces. It was a way of bringing together and formulating an understanding of what was happening. And my draw to art therapy quickly became one of like, how do I help people access that ability? Very much, people who are more creative or visual thinkers tend to think kind of all over the place. I kind of think about it as like the post-it note people, the ones who organize by putting a lot of like disparate thoughts out there and then figuring out how to pull it together, kind of like a really intense coding process. And my brain definitely works that way, but my brain also works very linearly and analytically. And I think one of the ways that I have really seen art therapy come into practice has been in the world of mainstream psychology. I've worked a lot in trauma focused models where you bring in evidence based treatments, where there's structure, there's science, there's research. And when you have a linear process, it's sort of finding the flexibility within structure. The creative elements are always the places where you can think out of the box and create innovation. And it's in some of those spaces that I've actually found art therapy to be a place where we can bring the awareness of how much this modality can work into sort of the mainstream psychology structure. And I think part of my work has been organizational work in learning and development and program development, disseminating treatment models, disseminating treatment. And the other part has been always clinical work, working with children through adults. And I think that very often, especially when it comes to trauma, we don't always have the words for what's happened. And many models have been organized through a cognitive lens of verbal expression. And when we don't have the words, what do we have? We know that trauma sits in the body. There are so many symptoms that connect to that mind body disconnect. And I found that through art therapy, we were able to help make these connections alive again. I remember working when I was in residential treatment with a young girl who was 13 who had experienced very chronic and long-term sexual abuse from a very early age. And her drawings would be kind of a self-portrait of her body with a head sort of floating above her with like a balloon string. And that was something she never was able to verbalize. But when we had the image, we were able to really connect, and she was able to recognize this dissociation that she had from her trauma, from her own body. And that reconnection process of helping her to realign the mind and body really started with the imagery. We She was a kid who had schizophrenia and trauma, and she didn't verbalize and express herself in ways that very often people would just disregard her and kind of put her in the box of the label of severe psychopathology. And yet when she drew, it was this whole world was revealed to us. And that's where we were able to make the inroads and eventually help her make more connections and really improve her functioning. So I think art therapy and the use of creative modalities opens a door, a window to a person's expression that on the surface we may never know is there until they can, bring it out in picture.
That just opened up a whole new lens for me. I mean, in terms of what the art therapist can do, what someone with art therapy or art therapy modalities can implement in terms of interventions to support that. I guess I didn't even give thought as I was processing this about how much we privilege nonverbal, or I'm sorry, verbal approaches to therapy. And this just makes so much sense in terms of how you were able to reach this young girl who had experienced so much trauma. I was thinking, I serve on a nonprofit board here in Los Angeles, Healing Arts Reaching Kids. And one of the things that they do is bring art supplies to children in the Children's Hospital Los Angeles. And this just has given me even in that short example you gave, a different lens about how this can apply in the mental health setting. So really, really appreciate that, especially, with that kind of opening doors, into the mind of a child or an adult, as you say.
I was just going to add on, I think so many programs that bring art supplies to kids, it's a primary vehicle of expression for young ones. We think and create visually before we think and express ourselves verbally. It's through pictures, it's through objects, it's through that kind of processing. And I think that what is so amazing about a therapeutic environment where you're creating a space with a client through art therapy is it's a facilitated process. And I think often, unless you are someone perhaps who's shown talent as a teenager and a young person and kind of are given all of those praises, very often you don't continue creating art. And many people get the message, I'm not an artist, I'm not good at it. And so this idea of creativity becomes one that it's for the few and it's really for all. It's the messaging, and that's what art therapy does, is that it's not about being an artist, it's about learning how to express yourself using the mark, the pressure on the page, the color, perhaps it's a realistic depiction, but that is what changes when you work with a therapist who knows how to guide you through that process. So adults who have never done art since they've been 7 or 8 years old can really do amazing things when it comes to a facilitated art session.
Maybe you could help me figure that out, because I got C's in grade school in art class, and I've been traumatized myself over ever doing art. String art killed me. I think I failed that one. It's awful.
Yeah, and that's something wrong with our education systems. I mean, my view is that everyone is inherently creative. We just have to find the pathway. And so maybe it's not picking up a pencil and drawing something that is a realistic, image, but there are so many other ways to express ourselves through creative modalities.
Well, let me ask you that. Let's dig into that for a minute, because someone like myself who doesn't draw, well, again, we could probably explore that in a session or two, right? But I express myself through music and performance. That's one of the things that really brings joy to me. How does the art therapist use other modalities? For example, with music, would you bring in a music therapist, or would you use that in your own practice? How does that work exactly?
I've used it in different ways. Early in my career, I had an internship in a medical setting doing child life. And so you're working with kids who have hematology and oncology diseases, and it's a team. And I remember being paired with a music therapist for some of our interventions when a child was getting a procedure. Perhaps they were getting a port placement, which is a painful, invasive procedure. We would have a team together where an art therapist would be paired with a music therapist, and a music therapist would be, for instance, beating a drum, right, at a I don't know, 60 beats per minute kind of heartbeat rhythm. And that drumming, while there was the medical doctors doing the work they needed to do, and with my facilitation, we were able to sort of use that space to sort of join together. And the client was able to create art. She was able to draw how she was feeling, or even just use, a crayon really hard on the page if it was something that was causing her, pain or discomfort. And all the while where the percussive was really helping her to kind of model the heartbeat. So music in terms of interdisciplinary teamwork, I think is phenomenal. At NYU, we actually have the students from all the various modalities, music therapy, drama, and art therapy, come together to do some cross workshops with clients. One of my favorite interventions to do with clients is to play music, and perhaps it's a generational song that is inspiring to them, or a song that they find relaxing. And due to the wonder of our technology, we can pull that song up right away in the studio, and that will be playing while that person is maybe just making marks on the page. So for someone like you, Nathan, it might just be like, let's put a big piece of paper on the wall, put on some of your favorite pieces, and just make marks that you feel are capturing the essence of the music. Maybe the music sounds like a color, or it feels really, it's very diminutive, and it's soft, and your mark making will mimic that. Or it's hard and it's bravado, and you're doing more bold colors. So that's also an opportunity to be more in that kinesthetic space too, with your body and the art making. So that, to me, is about expression. It's not about the judgment of the finished piece. Like, oh, is that worthy of a museum? It's about the expression. It's not about the product.
That's so cool. So, just a kind of a connected question in the therapy setting, especially for clients who see you or see our therapists. Counseling and psychotherapy can be expensive and inaccessible to a large percentage of Americans today. And then I think, okay, so then we add in an art therapist, music therapist, or someone with that connected intervention or set of techniques, I guess it would be the appropriate way to say it. How does one kind of come to that as a like a working class, lower middle class income individual? What options are there for them if they want to explore this side, or they're recommended to explore this side?
Well, one of the wonderful things that's happened in the field, it's been a lot of activism on the behalf of many art therapists and lobbyists across the nation, is really bringing not only a recognition of the therapeutic benefits of art therapy, but also the education about what it is, that it's a modality. Very often in large hospitals, in large nonprofit agencies, clinic settings, there'll be art therapists on staff, but in private practice, you don't see them as often. So one of the big movements that I'm seeing, I'm in New York, is that there is a huge push, a lobby that's happening right now around getting private insurance companies to reimburse for art therapy sessions. So that is really a big, obstacle for many folks gaining mental health services across the board in this nation is reimbursement. And it's also not been a fair system to the providers. So the compensation is not always great through those insurance panels. So there's a lot of lobbying happening to really do exactly that, make it accessible, make it something that is reachable for clients who are in the middle of the country or in a major city. And I also think that telehealth is really opening those doors to being able to reach folks who perhaps who are too remote to be in connection with a therapist, specifically an art therapist, because there's fewer of those folks in the larger cohort of therapists. And, telehealth has really become a wonderful modality, even for art therapy. Digital art making, collateral art making, sending art supplies to folks and having them, create and share that space within that virtual environment.
Yeah, that's so interesting. I want to get into the insurance discussion in just a second. It sparked a thought. My wife is in a counseling program right now, and she's about a third of the way through. And she's also an actor and an artist. She draws and does all sorts of interesting artwork. And she hasn't had time to create. And she was talking about, and this goes to your access around digital art. I was struck by, even I could do this. I mean, she was like, you could do
Ah.
and you type in words and concepts into an AI engine, and it produces basically this digital design for you to then manipulate and work with, which I thought was interesting. And, she and I were talking the other night about how in that moment she had been so disconnected from the process of creating that it gave her this release of being able to create. So I could imagine in the therapeutic setting, if you're not a drawer, not, even that could be an outlet for you, or even if you are an artist of sorts, that could be really meaningful.
Definitely. I mean, going back a long time, we're talking about like early 2000s, there were some very early versions of some clip art programs. And I remember using those with some kids who had a little, they were uncertain about the art supplies. There is, a bit of a trusting process that comes. Different mediums really elicit a different emotional response. So paint, for instance, is a very loose medium. It can become a very emotional, visceral material. So there is something too about a clip art program then that was able to be given to kids who were perhaps not ready for that next stage, but they were able to manipulate imagery and create environments and communicate their senses of safety, for instance, through this platform. And now, like you said, it's amazing. I had a grad student last year in one of the courses I teach. It's supervision. It's basically teaching them how to be clinicians. So we process every week cases and countertransference. And he was a really quiet guy. It was very hard for him to share how things were going and how things were feeling. And I have the students create an art piece of basically a reflective art piece that talks about or explains their countertransference, their thoughts, their feelings. And he did the most amazing piece. It was a moving animation with music that showed him on the subway with his headphones on, studying and reading. And in the subway window was a flashing of all the artwork that his clients were creating. And it had this like lo-fi kind of really chill music playing. And he wrote how his way of processing and understanding was through music, was through looking at the images to synthesize it because he didn't always have words. He was very shy. And he had shared he had selective mutism as a kid, and art was always the way he expressed himself. So his journey of becoming an art therapist was really, guided by this path. And in that moment as an instructor, where we still in graduate art therapy programs, we also rely on a lot of written and verbal expression from our students. This expression from him artistically through a digital art platform was really quite amazing. So like art can be anything. It could be anything. It's expression.
That's super inspirational. I mean, you had to be as a faculty member viewing that and really just kind of beside yourself trying to go, where has this guy been? And here is this amazing thing. And then you get into his head and you're like, here is where he's been for this time.
Exactly. It was that moment. I was like doing one of the fist pumps when I was reading it, and I sent it to our faculty who had been working with him. Like, look at this guy. Like, look at what he's capable of. Nobody has seen this part of him yet. And that's the story I think I can tell you 25 times over with students, with clients, that this window into who they are and what they're actually dealing with is opened. But we wouldn't have gotten there just verbally.
This is why we get into higher ed, folks. I mean, like that ability to see that potential unlocked. It's not about, making someone into something else. It's about watching that potential just like blossom. That's such a great story. Such a great anecdote. So we got to switch topics here. I wish we could have like hours to talk. I could pick your brain for a long time.
I would love that.
Well, I'll be in New York again soon, so we'll have to have lunch and talk through that.
Perfect.
When we talk about the arts in general in this country, it's wavering support, right? It's often seen as sort of a, kind of a nice to have, not a need to have. But even just what you've talked about today has such power and impact on the lives of people in a way that I don't think a lot of folks out there really realize is possible. And I don't even know that, I could be wrong here, but I don't know that there are a whole lot of artists who are out there that go, hey, I could really make a difference here. What could we do in this nation, maybe in our regions and localities, to strengthen support for the arts? And I'm not talking about production and consumption, right? The museum, the gallery, but for the use of expressive therapies and other modalities. I'd be curious what your thoughts are on that.
I love that question. I think it's really about fostering this idea of inherent creativity, that we all possess it. We're human beings, and I think when we don't have distraction, we're drawn to creation, and we do it all the time. Innovation is like the mother of necessity, right? Necessity is the mother of invention, right? So we're always kind of looking at how that's inspired, but how do we really foster that? If that's in early education, in the arts, and, really expanding that concept and the judgment too that surrounds what's good art and, what is good music. Are you going to Juilliard? Are you going to RISD? Are you going to a higher institution that is for that upper 1%? Or how do we foster this sense of creativity for everyone? And I think the mental health piece that coincides with it is that, destigmatizing mental health. We just like we all have creativity, we all have mental health, and we need to caretake for it. And we would never imagine just not ever going to our primary doc for a checkup or a physical, just going years without even thinking about it. But we do that with our mental health. And then when a crisis comes up or we are experiencing deep and perhaps, like stuck feeling places, we don't know what to do with it because we don't caretake for it. We don't provide the outlets and the education to destigmatize, the mental health that we all really require to be full holistic beings.
That's gold in a nutshell right there. That's very, very fabulous. And I think too, the connective tissue here with the creativity piece, right? It's sort of the through line through the arts. And, I think we could both go back through our high school days, our elementary days, all the way through college, undergrad, grad school, and in the real world. And I don't know in our educational settings that, I don't know if there's space. I think a lot of public school teachers and private school teachers would argue there's just not room in the curriculum. And yet I really appreciate where you're coming at from this, is that fostering of creativity is a larger concept for all, as opposed to band or choir for the talented kids who are, good singers or good instrumentalists, or the art class where, probably folks like yourself were drawing and painting and you were very talented. Nothing wrong with that, but like creating that vista of opportunities.
Exactly.
I really like how you position that. You also mentioned the issue. It's going to be kind of a hard left, but a back in turn is around insurance as an access point. So we've got the focus on creativity as a through line. We've got the topic of folks from lower incomes being able to access this. And you brought this in, I thought, really well. John Oliver, I don't know if you're familiar with who he is, but he came out with a recent kind of narrative on, insurance and mental health and how providers aren't getting reimbursed what they should get reimbursed. You just brought up a whole another level of this with art therapy and art therapists and the access to the insurance, so insurance actually providing these services. Do you have any thoughts on how we can begin to rectify this very intractable problem with insurance and providers and systems and whatnot?
I've never considered myself an activist, but the last year has really kind of propelled me in that direction. I think a lot of the answers is in lobbying in our local communities, our state legislature, to really support mental health reimbursement for all practices. We have music therapists, art therapists, dance therapists. We have all of these expressive art therapists who are trained in the same manner as social workers and mental health counselors and LMFTs. And one of the issues has been that those folks have been reimbursed on insurance panels and creative art therapists haven't. And so a lot of that, I think, lies in the lobbying and making change and being a strong voice and advocating for the clients who benefit from these services. And I do feel like there is a huge representation of the creative arts therapies in kind of public access points where you would see larger agencies who are serving clients perhaps on Medicare, Medicaid, and you have like a huge surge here, and then you have a very high pocket of the people who are out of pocket private practice who can afford to pay session fees with no insurance reimbursement. What we're really missing is the middle. We're missing the middle class of, we don't qualify for Medicaid or Medicare. I'm already paying a ton of money each month for insurance and I can't afford my deductible or I can't afford an out of session network fee. And so it's in that. It's how do we change that? How do we shift that? And I've tried to stay away from the political arena a long time and focus on the work. And I realized that it's both. It's in both places. So if we want to make change, we also have to show why we need change, publish more studies. I'm constantly encouraging my students to write and to share the work that they are doing, the amazing cases that they have been working on. And there's more programs opening on the doctoral level now too, where students are learning how to do those bigger, qualitative and quantitative studies that are getting out there. And that's also how we make change, by showing what it can actually do through the research.
You just are a terrific spokesperson for Saybrook right there.
Ah.
You're doing the work, as you say. Really great way to explain the situation. And I think for those listening who are therapists, who are therapists to be, this is a really important topic for us to be dealing with. I think it should not dissuade you from entering the profession, but it is something that Christina and her colleagues and a lot of therapists around the country, we need massive movement in this, and your voices are going to be important to that for sure. Before we end here, so I've got 3 more questions for you.
Okay.
So the first one is more about your experience in the mind-body medicine program and that mind-body connection. I'd really like to talk about how that has helped you professionally and intellectually, and maybe just give a teaser for folks about what mind-body medicine is. Sounds very West Coast for a lot of folks.
It has changed my practice as a clinician. It has changed my personal self care and outlook on life in so many different ways. To sort of sum it up as best as I can, I think I've always been integrative, as I mentioned earlier, and through mind body medicine, it's really acknowledging all the parts of the person. It's a holistic view of not only your thoughts and your feelings, but your body and this vehicle that we are living in, and how to really help all of these parts kind of move together and work together. I've had the honor of studying with phenomenal faculty here at Saybrook, and I have specialized in a few different areas, mindful and compassionate leadership, where we really think about how we can teach our leaders to be authentic and compassionate and lead our organizations, into really the next stage of, in my case, how do we look at mental health? And within that status, it's also thinking about elements of mindfulness. And I've lived in New York my entire life, and I've lived the hustle culture. And I can't believe what I used to do compared to how I see my life now, and where I can sit and sort of be aware of where I am in kind of body, mind, and soul in a place that has reflection and purpose and direction. And I think also the applied psychophysiology concepts. I started off with wanting to learn more, and I got my certificate in biofeedback, and then I decided to get my specialization in applied psychophysiology. And if I had another 4 more years, I would definitely do the rest of my training in psychophys, just to understand how much our mind and our body talk to each other constantly. And as a therapist, I've always worked with folks from a kind of top down approach. If you're thinking that you're not going to be able to do something, you're not going to be able to do it. And what the program has also taught me is how to work from the body up. So working with athletes and professionals, and really helping them manage performance, optimal performance, and anxiety and depression. But how do we do that from a body up perspective? So it's changed my practice. I will never work the same ever again. And I'm really identifying as an integrative mental health practitioner. And so my practice is now art therapy, evidence-based practices, consultation and training, and biofeedback. And so, it's really opened up so much potential, and I'm excited to sort of look at the next steps of how we can sort of see how these things can come together. So for instance, what would it look like if someone who was engaged in art making also was having some psychophysiology recording while creating? What would we see? Would we see sort of a lower heart rate? Would we see, more optimal HRV? What would we really notice? And I think that it would be tying together all these pieces of what we know works, but we don't always talk to each other. So how do we kind of pull that full circle? So I know it's a very long-winded explanation, but the mind-body medicine, sort of how I'm seeing and how I'm feeling it, is kind of incorporating, all of these pieces and trying to figure out further ways to kind of stitch them together and make those connections.
Again, you should just go on television and the interwebs and be our spokesperson. That was fabulous. I could listen to that all day. And I'm very serious with people like Christina, who are able to not just articulate, but live in this space and apply it in real settings, right? That's what you're doing. And it's pretty powerful to hear what you're doing, how you're doing it, and the impact it's had not only on others, but on your life. So that's very cool. I'll avoid any New Yorker jokes at this moment in time. All right, I got 2 more questions for you. So as we wrap up today, and these are just off the top of your head, don't give it too much thought, kind of rapid fire-ish, if you will, answer.
Okay.
What does the term humanistic mean to you?
Showing up in every interaction with authenticity, vulnerability, and compassion.
Oh my gosh, like you're a student at Saybrook University.
Something like that.
All right. Then what are 3 takeaways for people who want to improve their mental health right now?
Ooh, I like this one. 1, destigmatize mental health wherever and whenever you can. 2, when you ask, how are you? Actually listen to what that person says. And if you're the one being asked that question, don't say okay. Give a feeling word, an actual feeling word, and engage in a conversation around it. And 3, create time for creativity and connection, because that's where the resiliency comes from.
Those are rock star answers in my book. Seriously, those are fabulous. We haven't had a bad set of answers yet, and this one like tops the cake still. I mean, this is.
Does that mean I get to graduate? Does that mean I'm almost there?
It does. You're so close. I know. I don't think they're going to let me count that for the dissertation defense.
Oh, all right. Let me know if that changes.
You're fast, Grosso. You're fast. I'm telling you. What a pleasure, Ms. Christina Grosso, a student here at Saybrook University in the PhD Mind-Body Medicine program, faculty member at New York University, all-around extraordinary human being, artist, art therapist, and more, as well as a kick-butt New Yorker. And we were glad to have you here today. Thank you so much.
Well, thank you for having me. It's been such a pleasure talking with you as always. And I love the opportunity to share a little bit more about Saybrook, of course, and the field of art therapy.
It's been my pleasure and honor. Thank you, Christina.
Thank you.
I want to thank Christina again for this inspired conversation. She was amazing. She really gave us a strong sense of everything related to art therapy and the mind and body connection. I hope you enjoyed Christina as much as I did. Remember her 3 major takeaways. I thought these were gold. Destigmatize mental health whenever and wherever you can. 2, when someone asks how you're doing, really respond authentically. And when you are asking someone how they're doing, listen. Really lean in. And lastly, create time for creativity and connection in your day-to-day life. If you want to see the video elements, we've created these segments. Please visit our Saybrook YouTube page. And if you'd like to support the podcast, go to Apple iTunes and leave a 5-star rating and review, and subscribe so you can get episodes as they come out. If you're on Spotify, leave that 5-star rating and make sure to follow us. You can, of course, subscribe to us on most major podcast platforms, including Google Podcasts, Stitcher, Pandora, and others. Remember to check out our show notes for information on today's guests, including links to websites, books, and the like. For more information about our mind-body medicine program or the university, go to www.saybrook.edu. Click on Areas of Study at the top of the page and locate the program to learn more. Or simply Google Saybrook University Mind-Body Medicine Program. That's it for today. Thank you all. Take care and be well.